Hello everyone. We have a problem with children behaving badly. And I need you to listen carefully. And this is what I'm talking about. Bad oral behavior that should never, ever be ignored. If you look at the pictures on your screen, starting on the upper right hand side, mild breathing, snoring, sleep apnea, waking up too often at night, patient swallowing using her muscles of facial expression, using her lower lip and her chin, mild breathing. There's another picture on my lower right hand side. The effects of those two behaviors end up with a face that you see on my upper right hand side. Follow my cursor, my laser pointer. This child has a face that has grown downwards and backwards instead of going downwards and forward, like you see by the pencil line displayed on the screen there. The patient's face is now long and narrow, and it affects his airway. Poor posture, bad habits, tied tongue, mild breathing, tongue thrusting, using her lips as a major force to swallow, muscles of facial expression, thumb sucking. Ladies and gentlemen, these bad oral behaviors have consequences. What I'm showing you are the symptoms. Let's proceed. It is the intention of this presentation to make you aware that bad oral behavior can have detrimental effects with severe, devastating consequences, not only on the dentition, but also on the facial development. It also affects airway and self-esteem. But the good news is that it is preventable, and hence the presentation, and hence the awareness campaign. What do you mean by detrimental effects with severe, devastating consequences? It cheats our children from the power of a beautiful smile. What people notice first when they meet someone is a beautiful smile. 47%. The power of a beautiful smile and a beautiful face. It allows our children to set a good first impression. It protects our children from being exposed to discrimination, being teased and looked down upon. It places our children at an advantage because society likes to reward beauty in various ways. It protects our children from dental disease because it makes it more difficult to clean teeth that are askew, and it makes it difficult to chew with, and hence you find the TMD stands for temporomandibular dysfunction, which means jaw joint dysfunction. It improves the stability and function of the upper jaw, the lower jaw, and the nose. We call that the nasomaxillary complex. It contributes to self-confidence and success. They look good, they feel good. It allows genetics to express its full potential, giving them a better quality of life and a normal airway space. I'm Dr. Adams, and I'm passionate about prevention, and I hope at the end of this presentation, so are you. I have been teaching for the last 38 years, either at schools, oral hygienist, dental therapist, dentists in study groups, and now, ladies and gentlemen, it's your turn. There is a saying, change the way you look at things, and the things you look at will change. And I hope at the end of this presentation to change the way you look at things. Some definitions for the purpose of this discussion. Signs will mean the behavior of all the muscles of the face, whether it is the muscle of facial expression, the breathing muscles, whether it's the chewing muscles, the swallowing muscles, the muscles of speech. If they behave badly, It's a sign, it's a hint, it's letting you know there's a problem coming. There are going to be consequences. Symptoms will mean the effects of these muscle behavior on growth and hard tissue. So bad muscle behavior end up reflecting itself in either creating skewed teeth, abnormal direction of facial growth, affecting the airway. So you will see the effects of these bad habits. The term to introduce at this stage is that form follows function. If function is bad, form is bad. Now I'm going to show you some signs of bad oral behavior and of course the resultant symptoms so that you become more aware of this problem. We've shown you that picture already and gone through the discussions. I'm going to end this part 1 with the picture on the screen. The young lady on my left hand side has behaved dysfunctionally with bad oral behavior. She used to suck her thumb, hiding her thumb, can you see that? She used to swallow, thrusting her tongue between her teeth, and hence she has earned this dysfunctional face. Massive proclination of her teeth, sticking out the mouth, pointing forward. Spaces between the teeth, we call those diastemas, because she used to present these signs to her family, but possibly family were not skilled enough to be aware of the consequences that will follow, and hence she now presents with the symptoms, the effects of bad oral behavior. The patient on your right hand side had a problem breathing through his nose, ended up being a mouth breather, and has affected the direction of growth of his face. His face has grown downwards and backwards instead of growing downwards and forwards. The red line indicates a rough idea of where his face should have been. He's now about a centimeter behind that position. Hence, the mandible, which is the lower jaw, has a tongue attached to it, and that tongue now is sitting a centimeter further back, encroaching on the airway space. So this young man has behaved dysfunctionally and now has a dysfunctional face. Signs: mouth breathing. Effects: dysfunctional face. Patient on the left side: signs: thumb sucking, tongue thrusting. Effects: dysfunctional face. That completes part 1. I look forward to seeing you in part 2. We have 7 areas of dysfunctions to present to you. Thank you very much. Bye-bye.